I am Dr. Raghubir Banerjee. I am a practicing dermatologist, practicing in Wizderm clinic, Jodhpur Park also. Today I'll give you some insights into certain dermatological conditions and therapeutics which is of common interest to the general public. Now, throwing some insight into phototherapy. Phototherapy is basically a light-based therapy that is used in different chronic dermatological conditions. This is a very safe modality of treatment. In real life, it is not so expensive, easily accessible. The only downside that the person has to come to a certain clinic to take the therapy. And it is a very useful modality where ultraviolet B, ultraviolet A is used for different chronic dermatological conditions like psoriasis and vitiligo. There are different dermatological conditions. Phototherapy produces good results. The common conditions are vitiligo, psoriasis, chronic eczema, lichen planus, certain pre-cancerous conditions like mycosis fungoides, where it has been found that long-term treatment with phototherapy is safe and an effective modality of treatment. The phototherapy, the patient has to come to the clinic. There is a chamber which has ultraviolet tubes of ultraviolet B and ultraviolet A, where a graded exposure or a dosage regimen is followed. A dosimetry is done and the patient takes the therapy according to the graded dose that has been given, and serially we keep on increasing the dose to achieve what we call a minimum erythema dose. The phototherapy can be taken long term, and in my practice I have seen the results are evident after a period of say 3 to 4 months. This is the period where we start seeing the results of phototherapy in these chronic skin conditions. Well, as I have already mentioned, the results of phototherapy are gratifying. Only thing that we have to counsel the patient is to have some patience. You take an exposure today, it doesn't go away tomorrow. But the results become quite visible after a certain period of time. From 3 to 6 months is the period, especially after 3 to 4 months, that we start seeing, or the patient starts seeing, visible improvements in the skin conditions. So that is how we have to counsel the patient.